Namaste Bitya. Hamesha khush raho Bitya. A very good morning to you all. Myself, JD and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathic Science at Jyoti Vidyapeeth Women's University, Chennai. In today's clinical lecture, we are going to discuss about the various clinical features of the patient with depression who is coming to us, how to recognize that particular picture in a pictorial form. Just by looking at the picture of the patient, the different expression, how can you come to know that a particular patient is suffering from depression? There will be, in the patient of depression, you will find S. S is sleep disturbance. Most commonly, you will observe two things, either insomnia, that is, the patient is not able to sleep for the whole night, for the whole day, or there is hypersomnia, that is, excessive sleeping. The patient keep on sleeping for the whole day and night. So you will find sleep disturbances in that particular patient of depression. A. A represents anhedonia. Anhedonia is a term that is used in the cases when the patient does not find any pleasure or interest in any activity that was uh, producing a lot of pleasure in that particular patient. So, lack of interest or lack of pleasure is anhedonia. In depression, you will find anhedonia. D is diurnal variation of the mood. Diurnal variation means day and night variation of the mood will be found in the patient. Sometimes the patient will be feeling worse in the morning and sometimes it will be worse in the evening. W is weight gain or weight loss. Under depression, there can be two conditions in the patient. One, he can either eat too much, keep on eating for the day and night, for the whole day, whole night, or there can be weight loss, that is total loss of appetite without any desire, without any desire to eat food. So there, the outcome will be either weight loss or weight gain, too much weight gain. A is agitation. Agitation is the restlessness. The patient of depression can become restless and he can move here and there and does not find any particular thing. L is loss of libido, that is loss of sexual drive or desire in the patient is seen in depression. This is very common feature. D is dysphoria. Dysphoria is unhappy mood. The patient will always remain unhappy. He will keep sad. F is fatigue. He will always remain. The patient of depression will always feel fatigued. He will always feel tired. A is appetite disorder. Appetite disorder is again either it will be increased or decreased. Either he will be taking too much food or lack of food. C is concentration will be impaired. He will not be able to concentrate properly in any particular situation. Any work that you are giving to a person with depression will not be able to complete that particular work because lack of concentration. Low self-esteem. The person of depression will feel himself lower. He will feel that he does not know anything, and he will have a low self-esteem. There will be lack of confidence in himself. And last is the suicidal ideas. The patient with depression will ultimately end in committing suicide because there will be constant suicidal ideas in that particular patient mind. So these are the various features of the patient with depression. There will be sleep disturbance, insomnia or hypersomnia. There will be anhedonia, that is lack of desire or pleasure or interest in anything. There will be diurnal variation in the mood, often feeling worse in the morning. There can be weight gain or weight loss. There will be agitation, that is restlessness in a particular patient. There will be loss of libido, that is lack of sexual drive. There will be dysphoria, that is unhappy mood. The patient can be fatigued for the whole day and night. He will be tired all the time. There will be appetite disorder, with trying to eat too much or trying to not to eat anything. There will be concentration impaired, that is lack of concentration. He will be having low self-esteem, and there will be suicidal ideas, persistently dwelling on suicide and ultimately committing suicide. So all these common clinical features of depression, the word sad world faces. SADWALDFACES. This is the shortcut to remember all these things. S is sleep disturbance, A is anhedonia, D is diurnal variation of mood, W is weight gain or weight loss, A is agitation, L is loss of libido, D is dysphoria, F is fatigue. A is appetite disorder. C is concentration impair. E is loss of self-esteem. And S is suicidal ideas. So this was all for today about depression. In the next lecture, we are going to discuss a case of the chest pain. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.